Hello, folks. Join our community and stay up to date all the time with the ESTES podcast series. This activity is sponsored by the ESTES Education Committee. Stay with us. Stay with ESTES.
Welcome, folks. Today we are discussing a quality improvement program for the severely injured. Let's dive in.
I'm eager to hear about this. What are the main challenges in measuring the quality of trauma care, and how does this program address them?
Right, so traditionally, mortality rates were the primary metric. But as those rates have decreased, we need more comprehensive measures. The program uses the Donabedian framework, looking at structure, facilities, resources, process, care delivery methods, and outcomes, patient health, and societal impact. This gives a much broader picture than just mortality.
I see. So it's not just about whether the patient lives or dies, but also about the quality of life after the trauma?
Exactly, and that's a crucial point. The program emphasizes long-term recovery and the societal and economic impacts of trauma-related disability. It's a holistic approach.
That makes sense. But how do you actually measure these broader aspects? What kind of indicators are used?
That's where quality indicators, QIs, come in. These are carefully defined metrics, and the program stresses that they need to be important, useful, scientifically robust, and feasible. They cover various aspects of care, from pre-hospital response times to adherence to treatment protocols and long-term functional outcomes.
So how does the program ensure the quality of the data used to calculate these indicators? I mean, data quality is crucial, right?
Absolutely. Trauma registries are key. These are structured databases collecting standardized information. However, there are challenges. Many registries are hospital-based, missing less severely injured patients or those who die at the scene. Also, data quality itself is a huge issue. Incomplete records, coding inaccuracies, and variability across hospitals are common problems.
So how do they address these data quality issues?
Well, the program highlights the importance of validation. This involves comparing registry data with original sources to ensure accuracy. They also emphasize the need for standardization and ongoing refinement of data collection methods. International collaboration is crucial to develop consensus-based registries and indicators.
Interesting. You mentioned feedback mechanisms earlier. How do those fit into this quality improvement program?
Feedback is vital. The program cites examples like the Ramban model in Israel and a study in Taiwan, both showing that constructive feedback, coupled with corrective actions, significantly improves trauma care. This includes both pre-hospital and hospital care, focusing on specific aspects like airway management, treatment timelines, and even interhospital communication.
So it's not just about collecting data, but also about using that data to improve practice through feedback and collaboration?
Precisely. The program advocates for a whole system approach, recognizing the complexity of trauma care and the need for collaboration among professionals, policymakers, and researchers to achieve meaningful improvements in patient outcomes worldwide. It's a continuous cycle of evaluation, feedback, and improvement.
That's a really comprehensive approach. Thanks for explaining it so clearly.
You're welcome. And remember, folks, improving trauma care is a continuous journey, requiring constant evaluation, adaptation, and a commitment to excellence. Goodbye for now.